Harry Pinchot has lived two lives, the one before the phone rang and the one after.
I was in my office. I got a phone call, and it was the urologist, and very frankly, he said, "You have cancer."
Prostate cancer. Harry wasn't a stranger to it. His father, grandfather, and two uncles had died from the disease. Now he had it, and it was bad.
I was told anywhere from 12 months, 18 months. One physician said he could be generous and assure me I'd be around for 24 months.
Harry's diagnosis came after several frustrating doctor's visits. An elevated PSA, prostate-specific antigen, that failed to set off alarms. Harry's PSA was 16. Usually anything over 4 triggers more testing. And a biopsy that turned out to be misleading.
And they didn't find anything.
Harry was told to get checked again in 6 months. He came back in 5. The results were alarming.
My PSA had gotten up to 32 point something or other, which was major disease.
Which means that by now the disease had spread?
In reality, that's exactly what happened.
Harry's doctor advised surgery to remove the prostate, but Harry wasn't sure. Instead of heading to the operating room, he hit the books.
I spent the next 4 months at UCLA's medical library reading everything I could read on prostate cancer. And the more I read, the more I realized I didn't know, and the more I realized the medical community didn't know. And I sought out what I thought at that time were the leading edge technologies in trying to find the disease.
That was 10 years ago. Over the years, he tried a variety of treatments: hormone therapy, radiation, chemotherapy drugs, some of them cutting edge. He dropped the red meat and took to green tea. His cancer retreated, even though it was aggressive. Harry Pinchot became a self-taught expert on prostate cancer.
It's classified as a 5-alpha reductase inhibitor.
Devouring every study, chasing down every expert. Harry was on a mission, determined to educate himself and the public about the disease that afflicts 230,000 men every year and kills 30,000. So Harry went to work. Harry ended up here at the Prostate Cancer Research Institute in Los Angeles. It's a nonprofit organization co-founded by Dr. Mark Scholes that helps men navigate the dizzying array of treatments, doctors, and decisions that prostate cancer patients confront.
We could easily talk of a half a dozen different treatment options, such as watchful waiting, hormone blockade, surgery, which comes in laparoscopic and open surgery, different forms of radiation, seed implants, IMRT, proton therapy, cryotherapy, partial and full.
Scholes is Harry's lead physician. They know how daunting, lonely, and at times infuriating this medical maze can be.
Typically a urologist, because of his professional bias, that is, God gave him that scalpel and said go out and cure everyone, is going to want to do surgery. And a radiation oncologist feels God gave him that ray gun. And I know a cryosurgeon who has a picture of God handing him the cryoprobe and saying, go out and cure the world. And the medical oncologist, of course, wants to poison you with drugs. I don't fault them for that, because if they didn't believe in what they did, they shouldn't be doing it. But the reality is it's up to you to define which one of those guys has the real best choice for you.
Harry became an outspoken advocate and spread the message one phone call.
And then I'll mark it in on the calendar.
One meeting at a time.
Many of us in this room are sitting here dealing with mistakes. And we want to make sure that the people that follow us don't make those same mistakes.
Mistakes involving unnecessary surgery, false diagnoses, treatment that can change a man's life.
It's important that patients understand what they're putting at risk when they do a treatment, because there's no free lunch, no free ride in this disease. Any treatment you do can have a major impact on your quality of life.
The system is set up to solve the problem with surgery or radiation. The risks of permanent side effects such as impotence, urinary problems, and rectal problems can't be avoided.
That's one reason Harry refused to have surgery. The other was that his cancer had spread, which is why he urges men to get tested. Because if prostate cancer is caught early, before it spreads, there's a 99% cure rate. And it's why technologies such as this, the Doppler ultrasound, are so important. It uses color imaging to pinpoint cancerous tumors, making it easier to biopsy, track, and treat them. For men like Harry, it's much tougher. The FDA recently approved the drug Taxotere. It's considered a successful drug, but not a cure.
Okay. We got 2 more doses here, 75 capsules each.
So Harry pushes on. He knows so much.
Okay, bye.
He knows his son already has an elevated PSA. He knows he should spend more time with his wife of 44 years. Dee wishes he'd put that phone down every once in a while.
Prostate Cancer Research Institute.
And Harry knows something else. The cancer is back.
I think that after 10 years of this battle, I'm in the last battle. And I either win this battle or I've lost the game. And I hope to win this battle because the options are becoming very narrow.
It's a battle that's given Harry a purpose.
It's a lethal disease. It just takes its time in killing you. But that's a gift because it gives you time to do something with the rest of your life.
And how did you decide to use the gift?
To educate people not to accept that first diagnosis and to learn about the disease, connect those dots together.
Harry has helped more people than he'll ever know, urging them to be outspoken, informed, active participants in their own care.
What will Harry's grandchildren say about him?
I don't know what they'll say, but I do know that if they look and see what I did with the last 10 years, I have nothing to be ashamed of, that I've tried to help as many people as I humanly possibly can so that they don't walk down the same path. I don't want my son to go down this path, and I don't want my grandson to go down this path.
His advice is poignant and personal.
I think the most important thing I can tell you, to the guys who are in the trenches fighting this disease, is don't forget about your spouse. She's got many fears. You're fearing dying. She's fearing losing a great part of her life. Her lover, her husband, her source of income, her best friend. All of these things are on the line. You know, when the game is over and you die, your troubles are over, but hers move on. To men in general who have not yet been diagnosed, get tested. Don't pretend it's not going to happen to you, because it very well could.